of PAs gone to their graduations before, so, wow.
Yeah, and that honestly, you know, at the state level, would make a lot of sense for New Mexico to really look at. How do you expand the number of mid-level providers that you're gonna be putting out, your PAs, your nurse practitioners? Because at the end of the day, I mean, I'll quote you a national statistic, and the last time I saw a 92,000 physician shortage in about 2 years, going up to 125. So you're not gonna fix this
On the,
by adding physicians, and if you train a physician, I mean, 4 years of college, 4 years of medical school, and then 3 or 4 years of residency, 12 years from today, if you decide to invest in a spot to get it out. Whereas PAs, you're talking about even an associate's degree, 2 to 3 years of school, you know, nursing, potentially associates, but if you're gonna hire a level, you need bachelor's, and then so it's probably 6 years, you know, to open up those slots, because that's what you're gonna need to be able to provide primary care. You're gonna need the mid-level providers. You can't ride the primary care needs in this country on the back of family practice internists, pediatricians. It's not gonna work, I don't think.
You're gonna say something?
I just does UNM have the facilities to train more, to educate more PAs per?
I wish I knew.
Oh, okay, because I was thinking that was
certainly
one
find
of
out,
the
but-
issues when you kind of wondered about, and they said they didn't have the facilities to train more physician's assistants.
You know, I would assume that the university's probably training everyone it can, because there's no reason not to. And it's not, again, it's facilities, it's faculty, it's
Yeah.
clinical sites, it's the whole gamut of things.
Probably the best example I can give you in the last few years was, let's say when Senator Candelaria, this has got to be 3 or 4 years ago, he said, I want to put an emphasis on creating nurses. So cobbled together some money from the state and said, this is the emphasis we would like. I was at the meeting with Dr. Roth and our leadership at the university. So we said, sure, we will expand our capacity for nursing. Well, we started that program, but then the funding stream got cut off. And I don't think it was from the legislature. I just think it was by virtue of the things that happen as you're going through budgets. So it was one of those things where we had enhanced our capacity to be able to service that specific need, but then we had to disrupt it because the money, I'm not saying the money ran out, but the way we had planned it, the time it takes to say I want to create a nurse to when a nurse comes out the other side, we didn't fund it completely. And so that was very disruptive. I don't know whether I would really say that was the legislature's issue or if it was an executive issue, or it would be, I don't even think I could answer it if I had to. But that's a perfect example of what happens. The thing that's, as I'm sitting here, Senator, and looking at that wall of those children in the kids club, what I'm seeing is you have a bunch of children that are at their most hopeful life is going to get for them. This is when life is easiest. And this is when you start to say, hey, I'm not doing the same as the other kids in school, or I'm a little behind on something else. So you go see your counselor, and the counselor says, let's try and get you some help. So they'll say, let's have you talk with this person. And then that person helps with your parents and your school, and the community creates a plan to help you do your best and feel like you belong the most. And that, to me, is the concern, because I know that from working with you for 15 years, when we were looking at kids that are a little bit older than those guys, when they start to develop real problems, like I might have developed when I was 15, and I'm going in front of a judge, and the judge is saying, listen, I can throw you in the clink for 3 days, or we can have you do this and try and get some help for yourself this way. We've kind of lost the ability to do that with kids, to divert them away from into something that might actually help them in their lives. So those are, as I'm looking at it, the thing that stresses me out is I feel like maybe we have more than just an infrastructure problem, but it's the providers out in the communities. It's the options for our judges. It's the option for our counselors to say, listen, this kid is worth this other effort before we are going to just decide, you know what? And I don't know, I mean, this is something I know you've agonized over since the first day I met you.
Yeah, we've got to figure out how to get this done, and the sooner the better. I think we as legislators have to figure out a way to get more resources into the university to be able to get more nurse practitioners and more PAs out. Because it's double the time, basically. You're telling me 6 years as opposed to 12 years. And the lack of providers that we have in the state, I guess the way I'm gonna say it is at a critical stage. And if it's not a critical stage for the state of New Mexico, it's at a critical stage for Valencia County.
Yeah.
I mean, and a very critical stage that I don't know that our communities really understand. I would venture to guess, because I didn't know those statistics that you just cited me, in terms of the numbers. If our community knew that, I think we'd take a different approach to what's going on. I mean, I really don't believe our communities, Belen, Las Lunas, the rural parts of our community, understand the severity of the problem.
That was eye-popping when you went rattle off those numbers. I couldn't believe it. I saw my primary doctor yesterday, who's a UNM medical group doctor, and he was telling me also that, you know, it's not even a function of being able to recruit doctors to New Mexico, because, and I was shocked to hear this, you know, based on our conversation a little while ago, Joe. I guess the starting pay for a UNM, you know, person right out is like it was about, you know, 60% of what they could get if they just went across the state line and went to work for another, you know, university hospital or something somewhere else in the neighboring states. And so we've got to grow our own, because, you know, we're not going to be able to recruit into the state, it sounds like, so, based on pay rates.
I would say a couple of things. First, you're absolutely correct. And to put the emphasis for the youth coming in to go into healthcare benefits everybody. And the statistics are, for every $1 you bring into an area for healthcare, you get $5 back. So it's a great return on investment. And I think those are just the direct benefits, not the indirect benefits of people being healthier, et cetera, et cetera, et cetera. Bob and First Choice have a very, very interesting program that they're building, that if you haven't seen it, I would very much encourage you to take a look at it. It does really get down to very early interventions, very early support, and promoting, I think, an approach that would be very beneficial, not just to the region, but also to many states. So I would encourage you to take a look at that, because I think that he is on the right track with what he's building. The other point I would make is that, you know, again, I ran a physician practice up in Santa Fe. I've probably recruited, I don't know, probably close to 100 providers into Mexico. The approach we took is we paid what the national numbers were. They have surveys, took a look, that's what you get paid, national 50th percentile. Keeping physicians here, again, is the issue truly, not once, ever boiled down to money. It's lifestyle, is do people want to live here, do people want to stay here? It's all the other things around it. Again, not that money isn't important. You can't be a 60% in the hole and expect people to come out. But
Well, they come
it's
out with so
real.
much debt is the
Now
problem.
and that's where I was going.
Yeah.
The bigger problem here is the whole debt load. So when you're talking, this was probably 3-4 years ago during the legislative session up in Santa Fe. Having lunch at one of the restaurants we had a family practice residency at Christus St. Vincent with UNM. They bring some family practice residents. These guys are talking that they have $180,000 of debt coming out. And I'm going, $180,000 in debt. Your starting salary is about $180,000. You gotta eat, you gotta drive, and again, you're still making $180,000.
Mm-hmm.
Understood. But, you know, how are you gonna make it with those numbers and be in a place where you're gonna be happy and thriving and really investing in the community, et cetera, et cetera. So, you know, I know that's a much bigger problem, and I kind of get that, but that's another area where if you want to attract young providers, making it easier for them to stay in an area, being creative about it, is something that potentially is within your purview. Again, not simple solutions.
Didn't we do something like that, Joey,
Mhm.
in terms of providers that go into rural communities?
We did everything,
Absolutely.
we tried to make it easier for them to go out there and incentivize it for them.
And those programs are successful, right, for at least the period of time that you're required to stay. Question is how you hook people in to stay even longer, right?
Definitely.
And it's my understanding that the state support for loan repayment has decreased significantly.
That's correct.
Yeah, but you know, the thing that makes this partnership, another thing that makes this partnership important is that First Choice is a federally qualified health center system. Each of our health centers is rated very high in terms of loan repayment opportunity through the federal government. And so our providers, our physician providers, as well as our advanced practice providers, mid-level providers, and nurses can apply for loan repayment. A physician provider can receive about $25,000 to $30,000 a year with additional money to support the tax on that for the period of time in which they have loans. Usually it's for a two-year period. It can be extended. So that's another advantage if we can get the
Yeah,
providers
that's
into
not
the
bad.
system, you know, that we can at least address some of that at First Choice.
On your way out of town, have lunch at a place called Theophilos, which is across from the Luna Mansion. Dr. Whitworth, that was his home. And they gave him the land, they built him a home, and they had free passage on the train, just to recruit him to get him here, like 150 years ago or something.
But I think, at the state
Can't build
level,
homes for him, but,
it really needs to be on the radar screen of
Yeah.
what's gonna happen with the
Yeah.
provider shortage in the state, how you're gonna be able to recruit, to retain. And again, I think it needs to be a fairly broad swath. You're not gonna get to where you need to be if you're just concentrating on physicians. Not that physicians aren't important, but if you're really talking about the needs,
Well, it's always been a bleep on the radar, but I don't know, now that you're saying it the way you're telling us, it's gotta move up, because it seems like it's there, but it hasn't moved up much since it first started, and that was a couple of years ago, more than a couple of years ago.
Well, we had a major issue. So we used to, at least, if you go back preceding United or the folks that beat Value Options. So once they decided to do that, Value Options still said, let's have an incredible provider network out there. And then, so in the 32 or 33 counties, you only had a few that were really woefully inadequate as it related to delivery of behavioral health services. There at least was somebody there these young people could meet with, or the courts were ready to try and do some diversionary program with kids that were a little bit older. Once they moved away from Value Options, that model, to the United one, then you started seeing a different focus. We want it to be accountability, we want to make sure people are getting paid, but we want to make sure there's not fraud. Started putting all these other emphases on it. And as that happened, then we had everything that happened. And I think we all know, if you start telling somebody that's out there doing the best they can in the community, saying, we don't trust you, we don't think that even though you've made a commitment to be in this community and live here, we still think you're trying to rip us off. It's like people just go, you got, okay, I mean, then you're talking about, well, wait a second, shouldn't I just go someplace else and do this? Where people, so there's a part of this that has to do with our whole attitude about the way we're treating people that are treating our children, our loved ones. So that's the thing, Senator Sanchez, that I'm looking at. I'm listening to us talk about, okay, well, we've got, the rest of the state is a ratio of 1 per 1,400. And this is 1 per 4,000. So, but since I've known you, I've watched you say, listen, it would be really easy for me to think of this provincially and just do what's best for my town or my community or my community center. But I gotta believe that we can all do better together than we could do separately.
Sure.
And that's what so I do think that this is an incredible opportunity for the rest of us to sort of follow what you've been telling us for a long time. That, hey, listen, we gotta figure out for a way for this to be more than just a blip. This has to be a priority, and you're gonna have to focus on all these things. You're gonna have to focus on debt. You're gonna have to focus on the community needs, wanting to preserve the beautiful parts of our state, the fact that we do have people that wanna live elsewhere and make their stakes there, and how do we help them get the help they need and they deserve, and still get to preserve their identity as a culture and as a community. So I don't know, Senator, do you believe that this is something where, is it fair for us to want to say, we expect, we have to do this together? Is it fair for us
Absolutely have
to?
to do that. I think it's time to do it, and it needs to be the number one priority. You know, because if you have a healthy community, then you're gonna have people wanting to come in and build their businesses and get their economy back up. So if you have a healthy community, businesses will look at you a whole lot different than they're looking at us right now. They will wanna come into our state because we'll have healthy children, healthy adults who are able to provide the services that business provides to the communities. And so I think we now have to make this the number one priority. The economy is always, you know, the situation we're in, but I think the two go hand in hand. Healthy communities, healthy economy, and starting to explain to the young people how lucrative it could be to get into healthcare. I don't think we're doing enough at our lower levels to emphasize healthcare in New Mexico and then the need that we have in our communities. I mean, people are always looking for jobs, but they're looking for jobs in different areas. And they think the internet may be the answer to all their problems, but not everybody's good at the internet and doing those things. So I think that's something that we have to do, and I think that needs to be a priority for the whole state. You know, of course, I'm gonna continue to work on the issues here, but I think we need to do that through the university. And you'll have our support at least, well, you'll have our support.
Yeah.
And you sound like a Democrat, actually, when you said all those things. That was pretty nice.
I know, I was trying to remember myself, you know.
I kind of like that. I
Sort of, I get
You know, something that Bob's doing, actually, we're gonna be moving the Health Leadership High School to your campus, right? With your new project and all the growth you've got going on there. That's a small little way to get folks, or the students excited to maybe choosing that as a career for health. It's called the Health Leadership High School, I think. Yeah.
Well, I think we start talking about it a lot more than we have. Again, I'm gonna get the statistics from you all, because I'm gonna start talking about the statistics. Again, I just was not aware that it was that bad. I really wasn't.
I would make just two additional points, and maybe emphasis on the point. New Mexico's competing nationally with the provider shortage. Okay, so like that's what the landscape is. So you're competing with New York and Pennsylvania and a lot of other places that crank out a whole bunch of providers that tend to stay there. And to me, it just strikes me, and again, I am biased, there's no doubt, but it just strikes me, you've got a state where you've got a fairly high unemployment rate. You've got a healthcare need. So why don't you train people to provide healthcare? Good jobs, you need it. I think the solution is gonna be a homegrown solution in very large part. You're not gonna be able to sway a whole bunch of providers from other states, I don't think, in the current environment. So it just seems to align very well. Again, obviously not the need, there's a short-term cost to that. The long-term benefit, I would argue, is probably very substantial. And I know it's difficult to look out 5 years, 6 years, 7 years, but you know, if you really think that there is a healthcare crisis, which you could argue that in this county, probably, if not there, pretty close, you solve that with providers. How do you get providers? You probably build them yourself. It's probably the best solution to do it, especially if you want a long-term solution that's sustainable. And then those kids go into it, their kids go into it, cousins go into it, all of a sudden you're solving a number of problems.
I think that's a great idea.
Very simplistic, understood, but I think it certainly is a path towards a reasonably likely solution.
Well, thank you for your time. I really appreciate both of you being here. You've given me some really good ideas. And if I'm lucky enough to be back in the legislature, that's what we're going to emphasize. I mean, we're going to emphasize it more than you know. We really are. And we're going to count on you and you to help us out.
No, well, we're moving forward. Again, I wish that the industry was such that you could say, this is a great idea, let's go do it, and then a week later you're there.
Well, miracles do happen sometimes. Thank you, guys. Thank you very much.
Very nice to meet you.
You know how to get out of here now, don't you?